System-wise history for a patient with fever, Part 1. Systematic history. Symptoms focusing on specific organ systems will provide direction towards the likely diagnosis when considering infectious causes of fever. Malignancies may also be found in any organ system. Non-infectious inflammatory diseases tend to affect multiple systems together, although a single system may predominate. Infectious causes of fever. Respiratory tract. Upper respiratory tract infection is suggested by rhinorrhea, nasal stuffiness, sneezing, sore throat, cough, and a hoarse voice. Sinusitis is likely to cause facial pain and headache. Otitis is associated with ear pain, ear discharge, with or without auditory symptoms, such as deafness. Lower respiratory tract infections, present with a cough, productive of purulent sputum, shortness of breath, wheeze, or chest pain. Hemoptysis suggests invasion of, or damage to the blood vessels, of the lung. This is present in tuberculosis, invasive fungal infection, or non-infectious causes, such as lung cancer or vasculitis. Genitourinary tract. Lower urinary tract infection, classically presents with a combination of dysuria, frequency, urgency, change in smell, and color of urine. Upper urinary tract infection may have similar features, with additional loin or back pain. Sexually transmitted infections and pelvic inflammatory disease can present like urinary tract infections, with additional symptoms of a vaginal or urethral discharge, dyspareunia, anogenital ulcers, genital warts, painful swelling of the scrotum, pubic itch or swelling of lymph glands in the groin. Vaginal candidiasis may present as urinary tract infections due with a whitish vaginal discharge and vaginal itching. Bacterial vaginosis presents with watery, foul-smelling vaginal discharge. Gastrointestinal tract. Abdominal pain is central to almost all gastrointestinal causes of infections. It is important to characterize the pain, including the site and radiation associated abdominal symptoms, and relieving and aggravating factors. Gastroenteritis is the commonest gastrointestinal infection and is associated with abdominal pain and diarrhea with or without vomiting. Determining whether the diarrhea is acute or chronic can distinguish infective from non-infective causes. Jaundice is the classic sign of hepatitis, along with a history of exposure to risk factors involving contact with body fluids or excretions. Cholecystitis and cholangitis, classically present with pain in the right upper quadrant of the abdomen, associated with nausea, with or without jaundice. Intra-abdominal infections, like bowel perforation and peritonitis, present with varying abdominal symptoms, like generalized or localized abdominal pain, bowel distension, diarrhea, constipation, or vomiting. Cardiovascular system. Infective endocarditis occurs commonly due to infection of the heart valves. Symptoms are usually nonspecific, and the diagnosis should be considered in patients with damaged or prosthetic heart valves, or those patients with risk factors for recurrent bacteremias, for example, poor dentition, intravenous drug use, long-term use of an intravascular device, or underlying bowel cancer. Myocarditis is caused by viral infections and may be associated with chest pain, shortness of breath, or palpitations. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.